Hair has always been the most important part of our anatomy, symbolizing the idea of eternal youth, but also for men, virility, and for women, seductive charm. What is more traumatizing and more revealing of the years that pass than to see your hair getting thinner each day, revealing bald spots? A technique allowing for this does exist: microtransplantation of hair. A leading-edge application, microtransplantation offers several advantages. A near-perfect result guaranteeing a natural look. A result withstanding the test of time. Few or no side effects. No surprise effect in the patient's social life. We now know that hair loss in men comes from a double mechanism of hormonal activity and genetics, hence the denomination androgenetic. However, for women, except in certain particular forms, the origin is essentially unknown. For men, hair loss can reach the top of the head without ever extending to the sides and back. This is also the case with women, although much rarer. The presence of this band of hair at the side and back of the head, the donor zone, has made it possible to practice hair transplantation for over 50 years. This was renamed recently capillary microtransplantation because of considerable progress over the last few years in the preparation of implants in bald areas, the receiving zones. The observation of different forms of androgenetic baldness has enabled us to establish in men a 7-stage classification of the evolution of hair loss, the Hamilton classification. For women, a 3-stage classification, the Ludwig classification. 2 fundamental rules must be respected in the matter of hair transplantation if we want to achieve near-perfect results. The first is that the fringe should always be reimplanted in a high position for security, especially when dealing with young patients. The second is that the gulf must rarely be joined, and definitely never before the certainty that hair loss has been stabilized. If the results are reassuring as to the art and method of microtransplantation, the illustrations are a witness to the end of a story which started several months, or indeed years ago, in the doctor's surgery during the first consultation. The consultation is without doubt the fundamental moment. It is here that everything will be said, explained, planned, and finally agreed in writing in the patient's dossier. This will contain full details on the patient's lifestyle, eating habits, any treatment the patient may be following, the patient's mental and physical state. Once this stage is finished, the doctor will complete a questionnaire on the patient's family history with regards hair loss, the age at which hair loss started, any medical or surgical treatment which may have affected the subject, so as to propose a strategy best suited to the patient's case. If the patient gives good indications, the doctor will draw on his scalp the direction, movement, and angles in which hair will be reimplanted. Finally, the doctor will take leave of the patient without forgetting to give him an estimate, as well as brochures explaining the microtransplantation process, together with prescriptions indispensable to any future operation. On the day of the operation, a last confirmation is made with the doctor in the clinic room, where the patient will be able to rest, then freshen up before returning home several hours later. Before the operation, photos of the scalp will be taken to register the initial state of baldness. These will be added to the patient's case file. Capillary transplantation is carried out with the patient in a sitting position, leaving him or her the possibility of resting, working, listening to music, or watching a video under the control of an anesthetist who is present for surveillance purposes. The local anesthesia is the only time during the operation when the patient will feel a small sting equivalent to the one he is used to at the dentist's. Once the local anesthesia is done, the doctor is free to perform the 3 stages of the operation in this order: collecting of hair, cutting of the implants, reimplantation. Collecting of hair consists of taking a fine strip of the scalp from where the hair is the most permanent. This step is extremely rapid and is achieved with a micro-suture and the help of a reabsorbable thread, leaving a small scar that is barely visible amongst surrounding hair. The cutting of the implants is practiced using a microscope. This consists of cutting a strip of removed scalp into several micro-transplants of under 1 millimeter in length, each of which will contain one follicle unit of between 1 and 4 hairs. Reimplantation is always preceded by a new series of outlining so as to determine the implanting most suited to each patient. This stage consists firstly of a new local anesthesia in the area destined for reimplantation. The specialist will then practice a series of microscopic incisions which are destined to house the pre-prepared implants for the next stage. It is only after all the micro-incisions are finished that the assistants will once again intervene for the final phase of implantation. At this time in the operation, an atmosphere of total serenity reigns, allowing the patient to relax totally after what will have been several hours of rest. Once the implantation is finished and the verification is done, the patient will have his hair brushed and will be led into his room to rest for an hour before leaving the clinic, without the slightest plaster or bandage. Several months later, and after a session to check the area of hair loss, the doctor will be able to judge the first results during a new consultation. A new series of photos will be taken to register and confirm the quality of his work objectively.